Aging, sadly, is a fact of life, and unfortunately, it cannot be stopped. And in a society where we are judged by how we look, we're always in search of healthy solutions that can assist us in achieving a rested, fresh, and natural regenerated look. So we've brought Dr. Mark back into studio so we can chat about some of the options out there and also look at a couple of case studies to see exactly what can be achieved. Mark, thank you for joining us once again.
Thank you.
Now, Mark, we're going to focus on women today. Let's start maybe with the things that are causing the appearance of aging and sometimes an accelerated appearance of aging in women specifically.
We cannot start at a better place. To do an effective and a successful aesthetic treatment, you need to make diagnosis. Like this is medical work, so you need a diagnosis. We tend to forget that as we age, there's a couple of structural changes. Number one, the skull starts changing shape.
Okay.
Here we start seeing changes in the orbit, in other words, in the eye socket. Young patients have a round eye socket, and as we get older, it becomes more oval, creating space.
Right.
And older still, it becomes square. So, that leads to sunken hollow eyes and even the appearance of teardrop deformities. Our zygoma, this is the cheekbones that sit here, start flattening a little bit, and the maxilla, which is in the middle area, that starts recessing. Okay. But one of the biggest changes, and we see this in our older family members, is that the mandible, the jaw, starts changing shape.
Right.
A young jaw has a 90 or a square angle, and we also need to look at the height of the mandible. So in a younger patient, the height is higher. As we become older, we start losing bone and it becomes thinner. So think of someone that's removed their teeth,
yes,
where the chin starts rotating up, the lips start deflating, and the whole bottom third of the face starts decreasing. So that's structural changes of the bone itself. And then you have structural changes to the support tissue. In the midface, you have fat pads. On the eyes, you have fat pads. And they sit deep on bone and they support the overlying structure. As we get older, those support structures start disintegrating and deflating, leading to a volume loss.
Okay.
So now we start seeing flatness and sagging, which leads to nasolabial lines, the lines that run from the tip of the nose to the corner of the mouth, and marionette lines, and it creates jowling in the face. In women specifically, as we get older, we also started getting wasting in the temple.
Okay.
So, you start looking a little bit skeletal. The temple area is the area that supports the whole lateral side of the face.
Right.
So again, that sagging, the decrease in the sharpness of the jawline, that all happens. That's just structural changes. And then we look at structural changes to the skin. We spoke about collagen loss in the previous episode, and we need to address that collagen loss. I always say, you don't see lines and wrinkles when you see a patient coming towards you, but you do see the quality of the skin.
Okay.
So we need to address the quality of the skin. And exposure to sun and alcohol and tobacco smoke and all those kind of things will decrease the quality of your skin, the luminosity, the pore size, etc., etc.
Mark, it's fascinating because I think for so many of us, and absolutely I include myself in this, the expectation is that it's all about your skin. Your skin is sagging, your skin is becoming less elastic. But when you talk about the structural changes and the fact that the bone is actually changing shape.
Bone change.
So, we spoke last week about different modalities and different treatments, but before we get to discussing a particular case study, you mentioned lifestyle factors. So now we've got multiple factors in aging. There's genetics, there's lifestyle factors, and there's environment as well.
Yeah, epigenetics. What we do to our genes through the stuff that we do, the smoking, the alcohol, the inactivity, not sleeping well, drug abuse, sun exposure, that's most probably one of the big ones.
So if I could ask you a question around that to say, what sort of percentage of the deterioration in the structures of our face and body, as well, are genetic related versus lifestyle and epigenetic? How much control do we have? Maybe that's the question.
Michael, I actually think we have far more control than we want to believe. Look, there's nothing that we can do to stop the bone from changing shape. That's natural. Okay, so that we cannot change. But the other factors, the collagen loss, the sun exposure, the pigmentation, the pore size, those things are well within your control.
Okay.
Eating a healthy diet, drinking enough water, avoiding sun exposure, exercising, goes a very, very long way.
Right.
Using good moisturizer, sunscreens, etc., will help. And obviously doing small interventions like chemical peels or microneedling or dermabrasion, things like that will help. So we have far more control than we want to believe. You don't have to have bad skin.
Yeah, I've got an image here from one of your patients, in fact, and it's quite an astounding before and after. But what I notice about it is that this is not somebody who looks like, and I think you mentioned it in discussions previously, they've been sucked through a vacuum cleaner and every little niggle has been all puffed up. And there's a naturality to it. So maybe let's talk about what's been done in this particular case.
Okay, so if we look at this patient, if we look at the forehead area and the temple, you can see that on the before side, there's hollowing of a temple area. In the mid-face, that's the part between the eyebrows and the tip of the nose, we have recession of the bone, so volume loss, and that's what's creating the nasolabial lines. It's the sagging.
Okay.
If you see this, moment that I lift it up, the nasolabial line starts improving. So it's a support thing. And then there was a lot of laxity and sagging in the skin due to collagen loss. This patient's in the 60s. So what we've done with her was a combination treatment of biostimulator to treat the condition of the skin, where we addressed sagging. So if you want to see what sagging looks like, just do this, and you will see that sagging. The laxity you showed earlier in the previous episode. The volume loss, we used a combination of different tissue fillers. Tissue fillers with certain characteristics, some that give us a little bit more volume, some that gives us a little bit more support, some that's a little bit more elastic. And then what we've also done for her is we treated the jawline area, so we defined the jaw. You can see that the jowls looks much better. And we restored the volume in the submental area.
Okay.
And you can see that the appearance of the marionette lines have improved drastically. Also take a look at what the biostimulator has done to her neck.
Yes, absolutely, because literally everything is just, it's got sort of volume, as you say. But now what's interesting as well, going back to that thing of the changing shape of the bones, so the fillers and the biostimulators, they're creating that volume which kind of masks that deterioration. So you're rebuilding up, not the bone itself in any way, shape or form, but the structure around it.
It's a little bit of smoke and mirrors. None of these photos were touched up. It's literally you repositioning the tissue by adding the support that has been lost.
Right.
Both to the bone, the fat pads, and the skin. We said with biostimulators, collagen gives us structure and strength. So, by using these products in combination, placing them correctly, understanding what the underlying condition is that leads to what you are seeing, and understanding the properties of a product that you're going to use gives us the ability to take a patient who looks tired and sad and a little bit older to someone who is refreshed, revived, slightly beautified, and just more approachable. It's all about that first impression when you see someone.
And no doubt a great confidence booster for the person in question.
Absolutely.
Because they're just feeling better as well as looking better. Mark, if somebody wants to find out more, I'm sure people would, where do they get hold of us, of you? Remind us, please.
Our practice here in Bryanston, Johannesburg, the number is 010-824-1393. Our website, you can either look for Dr. Mark or the T Clinic www.tclinic.com, and just go to the aesthetic page if you want to have more information.
Wonderful. Thank you so much, Mark. Look forward to our next discussion where we'll be exploring some solutions for men. So thank you for joining us.